Welcome everybody to episode 4 of Shine Society. I am Catherine White, the Director of Marketing at Monarch Aesthetic Services, and I'm joined with my trusty sidekick, Shannon Connolly, our Director of Customer Success. And we have a special guest today. I'm so excited to have her on. Her name is Heather Miles. She's actually Director of Clinical and Commercial Enablement here at Monarch Aesthetic Services. She works with a ton of our reps and even our offices to kind of talk through everything skin, everything you can be putting into your practice. And so our topic today that we're focused on is cut the crap when it comes to skin longevity. And when we were talking about this over the last couple of weeks, we know a lot of offices ask us a lot of stuff like, what is skin longevity? What product should I be using? Do I care about this versus that? How do I make it profitable in my practice? And so that's what we're going to go over today. So thanks, Shannon and Heather, for joining us. Well, what I'll do first, let me just throw it over to you, Heather. Tell us a little bit about, like what should our offices really be focused on when it comes to skin longevity?
There's so many things, and I think it's just so perfect that you said cut the crap because there's so many things that you don't realize are important, but there's so many things that are important that are being missed. So it's both sides, I feel like, of the spectrum there. For me as a provider, we're being fed a lot of information. A lot of false information. So, science for me as a provider is very important. I want to know the whys and does it work? But then there's all those other little things that become really inconvenient for a provider. Shipping, is it affordable for me in my practice? Is it stable? Is it safe? And does it work? Those are things that you don't really think about until you already have it in your hands or you're looking into something. And those become my questions are, does it work? Absolutely. But what all goes along with that? And is it safe?
No, I think those are all great questions. And Shannon, you talked to thousands of our offices. What questions are you getting from a lot of our customers about skin longevity?
Well, the biggest questions I get is, what is PDRN? How does it differentiate from an exosomes? And I know Heather is the guru with all of this, and I cannot wait to hear your explanation because I'm looking for some tidbits to share with our people because I get that the most. What is an exosome versus PDRN? How do they work? How do they fit into the practice? Why do they have to be refrigerated? There's all of these questions that come around for people that they know they work, they know they want them, but they just don't have the basic science. So Heather, can you kind of share your elevator pitch to those type of questions?
Yeah, absolutely. So I love this because this is another thing that the science, there's so much confusion. You would not believe the, do you actually know what an exosome is doing for you? There's that question. You would not believe how many people I talk to other providers that truly don't understand what an exosome is. So there's a lot of confusion there, and that's why people think it's a buzzword. The exosome still is very important. It's just all in how we use it. So there's a few things that I like for people to understand. The exosome is not a cell. It's just, we tell people it's the text message, it's the delivery system. But I was on a skin longevity call and this doctor was trying to describe it. And he had this fantastic way of putting it out there. And he's like, okay, the exosome is the Amazon delivery truck. The actual truck itself is not as important as the package inside. And then that the package inside is getting delivered to the correct address every single time. So you could have a bunch of Amazon delivery trucks and no one could care about them unless it's delivering us the package that we want, which is AKA the ingredients inside of the exosome, and that it's being delivered to the correct address, which is in this case to a cellular level so that we can actually get the skin longevity benefits out of it. That's kind of the way I describe it. So in particular with products like the VTech system, this is a phenomenal skin longevity product. The exosome is crucial in this because people are like, well, do we need the exosome? Well, yes, in this case we do because you cannot deliver a high molecular weight PDRN at the concentration that the VTech system has to a cellular level without the exosome. So that delivery truck, the exosome, is very important in this case because our body has these enzymes that are almost like when your immune system kicks in, and it can attack them or eat them, in other words, before it actually can communicate at a cellular level. So we have to have all those things. We got to have the delivery truck to get the package where it needs to go, but the exosome gets it to a cellular level, and then we can have that high potency PDRN, and then that equals the skin longevity. Whereas if you just rub high molecular weight PDRN on your skin, sorry, that may sound great, but it's not going to get anywhere. Not without the
Love it.
delivery truck.
So it's like you need to be an Amazon Prime member as your exosome instead of just going through USPS. And we all know how that feels.
Yes, that's 100% correct.
I
Okay, I
love
love
that
it.
explanation. I love that explanation. It solves a lot of problems. I think a lot of people have questions and they don't even really quite know what question to ask to get the answer they're looking for. And I think that analogy you just gave, like, will sum it up in one little button. I love it. Thank you.
Yeah. Well, and then I was going to ask you because I hear this question a lot, and this came to me while you were talking. Okay, so great, we've got the delivery truck, the Amazon delivery truck. Why do we care what's inside the package? Like, what's good to have inside your package from a skin longevity standpoint?
Well, in this case, I keep referring back to the VTech system. I've used different types of exosome or different types of delivery systems. And in this case, the bioengineered exosome, we get to choose exactly what we put inside. So that's what I like compared to, let's push aside for a moment any sort of safety aspect to it. But compared to a human derived exosome, we don't really know if it's viable or really what is inside. You can't say that. So when you have a bioengineered exosome, we get to pick those skin longevity benefits, properties, ingredients, whatever peptides we want to put inside. But you also have to know that the exosome is teeny tiny. So there's only so many things that you can put inside. So you have to be very specific and strategic on what it is. So a high molecular weight, 2% PDRN, that is going to be across the board, this universal product that's going to give us highly anti-inflammatory properties. The skin longevity portion of it, which is skin health, hydration, it's going to control pigment, melasma, texture, tone, give us some firming, elasticity in the skin. So just very well-rounded ingredient that's inside of this exosome. And then you have the biomimetic peptides, and biomimetic is basically like bioidentical. So it's human-like, but like the AI. So it's communicating, and our cells don't know the difference, but it's non-human. And we specifically choose biomimetic peptides to put inside that can do firming, lifting, and tightening as well. But then we have the other side of that for the angiogenesis, which is like wound healing and actually revascularization. So we have revascularization. We also have nutrients, oxygenation, good blood flow, healthy skin. And then they also put an antioxidant in there, which we all need the antioxidant. So whatever you can pack inside of that, that's why they specifically chose these ingredients. And all of those have a skin longevity property. And skin longevity, to me, it's like you go to the gym and we say, well, why do you go to the gym? Well, because I want to be healthy. Well, what is health? And you start describing what is health. It's the same thing. Skin longevity is skin health. So skin health equals good quality skin, healthy tissue, firm elasticity, hydrated skin, and just overall good quality skin. So that's skin longevity in a bottle.
I have a question. Why are some exosomes, do they have to be refrigerated and the bioengineered ones do not? Can you explain that?
Yes, absolutely. So the bioengineered exosomes or bioidentical, so it's made to mimic a human exosome. So we don't know the difference. So that makes it shelf stable because it's actually built from scratch, like a bubble from the ground up in a lab, just like medications, bioidentical hormones, all of those things are meant to communicate with the human body to some degree without actually being human to human. So that's what makes this shelf stable and you don't have to refrigerate it. If it is human derived, however, it cannot stay viable no matter how they ship it. If it is not remaining in the refrigerator, remaining on ice, whether it's freeze dried or not, it still has to be stable because as soon as it's heated up or reconstituted, mixed with something, the time starts ticking and it goes bad. So if it warms up and you don't have it in the refrigerator, there's no chance that it's a viable product.
Makes sense. I feel like that takes some headache out of it too. Because you know, you can imagine like when you order something and it gets shipped from somewhere and you don't know how hot it is or you don't know how long it took to ship to you, and then you're like, I gotta put it in the fridge. And you might want to make sure you have a big fridge. Like I can see how that would be like a stress, you know what I mean? So it's like being able to be like, okay, cool, they're bioengineered. And then I also saw they're sterile, right, Heather?
Yes, yes, that is for me as a provider, anything that I can do to take out the garbage or cut the crap, we're cutting out all the bad. You know, if I am opening up a channel or using this as a glide with my microneedling, which I do a lot, if I'm putting this on compromised skin, not only sterile being more safe, but it also just pulls out all the extra nonsense that I may be driving down into the tissue. So it gives me that extra safety component to it, which I really like. So I think that that product being sterile is important. But you know, when you talk about the shipping, that's another thing with the bioengineered exosome that when they show up and you have 6 boxes in your hand, it's so easy for me with a bioengineered exosome product to put it in the shelf and pull it out when I need it. Whereas when I was using other products or other exosomes that were human derived that had to be refrigerated, if you would order a promo and you had 6 boxes sitting in your mini fridge, that is very inconvenient.
And then how does, I mean, you're talking about the VTech and you've had other products that you've used. What is the like recommended? Let's talk about the dollar part of this, you know, and how,
Mm.
what is the recommended? I mean, is the price point the same that practitioners should be offering, or, you know, how does it compare with the other ones in the market for in the practice?
From experience, we're still charging around the same for these elevated procedures. You know, I used to do a lot of PRP. I mean, still do, but doing microneedling with PRP or injectables with PRP. But then we move into these more consistent products like this. And we're just moving up in the world as far as like, I always say it's like I went from my iPhone 14 to my iPhone 18. I'm still moving through the line of the same concept, but I'm elevating these treatments and getting better as I go. So still doing those other things, but price point wise, we're still charging to get that value across the board, what other people in the community are charging. But what matters to me is that I can get my price point down lower, that I could essentially eat the cost of this and actually pair it in rather than upsell it. Even though I'm really good at my job, it is very difficult to do that. If they're already spending $1,000, for instance, on a procedure or a service, it's really hard to say, oh, and then let me tell you about these amazing exosomes or whatever it is that I'm using. This is going to be great for you. That'll be another $200. It's really hard to do that. So I like to pair this in. And in order to do that, I've got to be able to get my costs down. With some of the products that I've used in the past that have had to be shipped frozen, in order to do that, shipping is extremely expensive. I've spent $300 for shipping before, no matter how much I ordered, didn't matter. And then if it showed up, just like you said, if it came UPS, heaven forbid, I'd left 2 minutes early before they showed up. And then the product sat on my, or out on my porch or in the front like awning area for the weekend, and then I have a ruined product. It's just very stressful. So that's huge when it comes to that. But then also this particular product, the VTech system, very affordable. I mean, my average cost is anywhere from it's about $18 per milliliter, but I use for most treatments across the board in my practice about 2.5 mLs. So it's about $45 a treatment. That is really easy if I pair it into microneedling. That's $550 to $600. I can pay for a $550 box of VTech in one treatment. $45 to $55 is my cost. Really easy to pair in to an elevated microneedling treatment rather than upsell. Huge, huge benefit for me. And then I've paid for the box, and then I have a really nice margin to get me through the rest of the box. And I have a take-home product that's inside of the system for my client, which is a win-win. So yeah, those are things that are just all important. What's included in there, getting my costs down low, because some of this stuff is very expensive and it's really hard to get your costs down, and then you can't eat that cost. It's just
Yeah.
impossible. But this is very affordable.
Yeah. And I love one of the things that kind of you mentioned when it comes to like putting we get or not we get to choose, but the company has chosen what goes into these exosomes. It's like I've seen just on a marketing standpoint, people are doing like, oh, let's just do PDRN, but a PDRN facial is like $1,000 or something like that on top of whatever your microneedling cost was. And I'm like, wow, that's kind of crazy. So hearing this makes a lot more sense from both a patient and a provider standpoint. And then shipping too. You don't even have to stress about $300 in shipping. I hate paying for shipping. We just talked about Amazon Prime. I don't like to pay for shipping. So I totally
Oh,
understand like how you wouldn't want it to be and create like a crazy amount of added cost to something that doesn't make you money. Like shipping doesn't make you money. You know what I mean? But one thing you
yes.
mentioned, and I see this everywhere, is you said there's a take-home product with the system. Tell me more about that.
So the VTech system inside of the box, you have the product that typically we would use as a provider inside of the office. And that's whether I'm using it as a glide for my microneedling, if I'm putting it on topically after an IPL treatment or fractionated CO2, anything like that. Topically after hair restoration, a chemical peel, it doesn't matter. Like if I put it on topically, I use my sterile product. It's inside of a vial in the treatment room. And then there's a take home gel mask that's more of like a serum, self-absorbable. So you don't wash it off or anything, but they go home with this and it gives them the same active ingredients plus a little bit more in the packet of what I just used in the treatment room. So they continue to use that throughout the next couple of days to help with continued healing, to help with hydration. It also has the PDRN in there, but it's a low molecular weight, still has the bioengineered exosome delivery system. They can apply it topically, but it also has hyaluronic acid in there. So they're getting that drink of water for the skin. It has healing properties, aloe vera in there, which is similar to like what a vitamin E would do for the skin. And then it has your copper tripeptide, which is your GHKCU. It's got all the goods in it. So it's such a nice product. But yeah, that's their little take home. And hey, who doesn't like a take home product whenever you leave a treatment? And there's actually, not to stray off, but when people fall in love with the packet, because it is a sample size, it's 5 mLs. There is actually a take home, it's a retail product that I can sell to them as a treatment while they're doing their series of whatever it is that we're doing inside of the office. They can use this at home product every day, which is the exact same that comes in the packets. It's just called the Exotech gel at home treatment.
Ooh, I think I love that. Anybody would want something like that, right? I feel like Shane and a lot of our offices ask us that too. They're like, what can I be doing after? Like, is there something else? Well, there's your something else, right?
And it's all included within the price of the VTech system. I mean, it includes both of them to where most other companies, you have to buy the exosome and then you have to buy their take home product afterwards and another shipping, another, it's the whole thing. So this is all part of one, which is just, it seems like a one and done.
Shannon, that's actually a really good point. That was something too, is that I found myself saying like, okay, well, I'm using this exosome product. And then, the huge launch with PDRN came out and it's like, oh, well, then I've got to go over here and use this PDRN product topically on top of the exosome that I just paid for that was expensive. And now I've got to go and find this retail product that has PDRN in it so that they can still use this at home. And it's so expensive for me to do that. So to have everything in a system for me, gosh, just makes it's just better for everybody.
We
Well,
like it.
and the cost seems to be the same as the other ones out on the market or lower,
Yeah,
and you
I feel like it's lower when I've compared it. There are some of them that I've had that don't even have the exosome delivery system. Actually, most of them, I don't know any that I can name off the top of my head other than the VTech system that have both a high molecular weight and the exosome delivery system in one bottle. But yeah, I mean, I haven't found anything yet that can get me below $55 a treatment. I mean, that I can think of at all.
that's amazing.
Yeah, that is awesome. And for those of you guys who don't know, Heather has an incredible background as a nurse before she joined our team. Heather, what are patients saying when they experience the VTech? I'm just curious because we've seen a lot of people have PDRN or exosomes on their own, but since this is an elevated system, what are patient reactions like?
So it used to be we would market this, it was just, oh, this will help you heal faster. Now we're just at a completely different level. Just like I said, the iPhone 14, okay, it's great. We've been there. We're good. We like it. But then now we move on to the iPhone 18 and it just has so many more features. That's kind of what I explained to them. But then when they come back, they're like, I don't know what that was, but I just saw the biggest difference in my skin, you know? Like they don't ever remember really. Like you can educate them, but eventually they're most of them when they come in, they're like, I don't remember what you did last time, but whatever it was, I really liked it. You know, they trust you, and that's what your goal is. But I do educate them on it. But what they say is, whatever you did last time, I saw the biggest difference. Like we've been microneedling for years, and whatever you did this last time was like just something about it. I was getting more compliments with my skin. And I just think because of this added benefit, it just puts a pep in their skin step. And when I say skin longevity, again, like you can tell that the quality of their skin is better. When you take before and afters, which is like the deal breaker, you have to take before and afters. Not only do they see that in the pictures, but they see it in the mirror and they go, oh my gosh, I really can tell that my skin is changing. That's what I like about this. It really works. It's not just a buzzword.
Well, and I think it puts the long in longevity. I mean, you mentioned all of these other things that are included in the exosome, that it's like for overall skin health. It's more than just like, let's help you this one treatment. It's like, let's help your skin actually be healthy. Kind of like what we said ahead or in the beginning, right?
Yes, absolutely. That's why I said just like going to the gym. Well, what else do you have to do when you go to the gym? You know, you can't just go to the gym and expect to be healthy. And that's kind of the concept here for the skin, and the longevity portion of it. We're getting a treatment plus the skin longevity. So if we can encourage the overall health and slowing down cellular aging, everything is going to look better in the skin.
I love it. So I'm gonna ask the big question that I think a lot of our listeners are probably gonna ask us. Who can buy this? Is this like who can purchase it?
If you are a licensed professional, you can purchase this. We don't sell direct to consumer, which is really nice. However, if you are an esthetician with a day spa, or you have a salon suite that you rent and you do facial treatments, if you're a licensed esthetician, you can absolutely purchase it all the way up. So our registered nurses, nurse practitioners, PAs, and MDs, med spa, derm, plastic, day spa, your own stop shop, whatever you have, you can purchase it if you're a licensed professional.
I love this. So we can do skin longevity treatments with VTech for anyone.
Yes. And if they come into you with compromised skin, we see that all the time now. People's skin inflammation is a real thing all throughout our body. So people come in with inflamed skin. So this is something that's really good for that as well. We have a lot of estheticians that are using the VTech system and their ultrasound machines inside of some of their facial platforms that they're using. And they just drive this in with their ultrasound or their non-invasive RF platforms, just so that people can get some healing for their compromised skin when they come in.
Nice.
Yeah, that's amazing.
I love it. Well, Shannon, did you have any other questions about we're cutting the crap on skin longevity?
No, I think you said what the price was for the whole box for the whole get and go. It was at 550, did you say?
Yes, one box is 550, but there's also buy five, get one free. So, I mean, you save $550, you save on shipping, which some people factor in. I have always factored in my shipping into my cost. So if you do that, then that definitely saves money for your cost. And that gets you down to $18 per ml of product if you do the 5+1 promo, which we always do.
No,
I
I don't
love
think
it.
you had any other questions. And Heather, you are amazing and a wealth of knowledge. I am so glad you came on to explain this to us.
Thank you. I love this. I've tried a lot of things out there over the years. 20 years in medical aesthetics. March was my anniversary in medical aesthetics for 20 years. So old enough to have been here for 2 decades.
Well, I think that's fabulous. Again, I echo Shannon. Thanks, Heather, for joining us. I mean, we knew we wanted to talk about skin longevity and really get down to the basics and have people understand what the heck they're looking for, what the heck they need to grow their practice. What's, like you said, the iPhone 18 out there. It sounds like VTech is the iPhone 18 out there, or whatever iPhone version we're on now, 20, 30, 40. So thank you
Jeez.
for sharing. I know there's too much and too many iPhones out there. But anyways. Thank you, Heather, so much for sharing. Thanks, Shannon, for always jumping on. And thanks to everybody for listening. We will have another episode coming your way shortly. So stay tuned. And what do we say? Oh, shine on.
Fine on.
Shine on.